of Corrections and Rehabilitation. Zach Allen is our marketing director for CTA, and he's going to help me with this today. So please bear with us as this is a huge group of people trying to conduct this over a webinar. So we'll try to make this as effective as possible. So 11:34 now. Let me give it one more minute as people are still popping on, so that we're not interrupted quite as much by the popcorn bells. All right. I think it's finally slowing down a little bit. So, Zach, what's our total count at this point?
Russ, we're up to 132 currently.
Thank you. All right. Well, welcome everybody. Good afternoon for most of you, probably. Good morning for a few of you that may be on the west coast like me. Again, this is Russ Nichols. I'm the CIO at California Department of Corrections and Rehabilitation, the president of CTA this year. We've got a number of our CTA board members on, including Zach Allen, who's going to help me facilitate the session today. So just a little bit of meeting hygiene. If everybody could remember to mute your device, your phone, to the extent that you can, to keep the background noise down. For anybody that's actually on a computer on the WebEx session, if you have questions, because the group is so large, it's going to be hard to facilitate voice questions. So if you can, type them into the WebEx session, and Zach, if you'll help me try to go through the written questions as they come in. We'll try to address them that way. We'll also try to facilitate as much open conversation as we can. But again, with 130 plus people on here, it'd be very easy just to have verbal chaos as we're stomping on each other, trying to get the voice connection. So just be aware, and we'll work through it. Absolutely. All right, just a couple of ground rules. Really, this is discovery. It's an open conversation to figure out what we're all doing related to the COVID-19 or the coronavirus outbreak that we're all going through. What technology are we bringing to bear to help our organizations? What are some of the issues? Really to share ideas. We may have somebody in a local jurisdiction or another state that's doing something differently that's an aha moment for some of us, or maybe have learned a hard lesson with something already, to share those type of ideas. So that's kind of the genesis behind this. Obviously, this was spun up very, very quickly, so there's not a whole bunch of production value to this. In other words, you may see typos where I put the slides together fairly quickly. Please bear with me on anything like that. Again, it's to facilitate conversation. One of the other things I want to be careful of, we do have both practitioners and our vendor partners on the phone. In fact, this is open really to anybody that wanted to join. We're not limiting it to specifically CTA members. We've got other folks that were invited and are more than happy to have them participate. One of the ground rules, though, with that, it's intended not to be a marketing session for a specific vendor, or frankly, even let's beat up a specific vendor because of an issue. Rather to talk about things more at the level of phone calling, for example, not specifically call out what one vendor is doing that another may or may not be. But what are we doing with phone calls that would add value for our inmates? So with that, Zach, let me defer to you for a second. Do we have anything else in meeting hygiene that I did not hit that you want to get up?
I think you've covered everything. The only thing that I would say is please just make sure that you're muted. And I am recording the session, so we will put this out later on, either through the website, the CTA website, through listserv, or through Twitter. One or all of those platforms will put the recording out there.
All right, and Zach, can you see the presentation screen okay?
I can.
Okay, I'm going to go ahead and jump in, assuming I can get my machine to move through the slide decks. There we go. So just for everybody's benefit, this is the board of directors for CTA. the folks that we talked about this idea in hosting a call. And so if it doesn't go well, you can pick out any of those names other than mine and give them a personal call. We really, as a group, hope this adds value to the corrections community in general. And if it does, we'd be happy to continue doing something like this through the course of this health issue that we're all dealing with. So with that, here are the general topics for today. If anybody has a specific item you don't see on here, go ahead. If you're on the WebEx session, fire a note off to Zach or in the client, and we can come back to that. We do only have an hour, and I think it would be very easy to take any one of these bullets and talk about them for a full hour. So we'll go through it fairly quickly. I can start the topics with conversation from what we're doing from California, but frankly, my intent is to learn as much from you as anything else. So we'll go through these and see what kind of interaction we can have. So with that, we'll jump right in. So with in California, a lot of folks probably saw on the news in the last 24 hours that our governor has issued essentially a work-at-home order or a stay-at-home order. It's coming out as being referenced several ways. Shelter-in-place has been the actual terminology that's been used officially. What he's asking is anybody that's in a non-essential function to stay home, really for the next 4 to 6 weeks, I think was the period of time that was in the executive order. It was just published this morning. With that, what that means is a lot of folks will be reducing their travel and working from home. And obviously in a corrections organization, we have a lot of staff that cannot do that. The officers that are out in community corrections, the officers or guards that you have inside your facilities obviously have to walk their posts, their tiers. But there are a huge number of folks in HR and accounting and even in the command staff that could work remotely. And what does that mean for us? So from the technology perspective, as examples, we're seeing lots of requests for remote hearings from our border parole hearings. And that includes trial appearances in county courts. One of the things that we do in parole hearings as we evaluate folks is we have a commissioner that usually goes and conducts a hearing on site. As we're setting it up now, the actual commissioner will conduct the hearing from their home and use a video session in as well as any other participants in that hearing. Obviously, a lot of increased bandwidth and security concerns, but those are some of the things that we're doing. So let me pause there, and Zach, I'm going to ping you directly. How best do you want to do this? I can run through the slide deck, and then we can do a lot of Q&A at the end, or we could take questions in flight. Do you have a preference?
I would say that we take questions in flight.
All right. So as it relates to the video conferencing topic and potentially sorry, I just saw a message flash up there. As it relates to using video conferencing, whether it's for inmate to courts, staff to staff, frankly, just general business meetings. We do have a topic on here a little bit later around visitation processes through video conferencing, so I think maybe we hit that separately. But let me pause there. Zach, I saw the way I've got my machine set up, I can't see the comments after they flash on the screen. So do you want to, can you try to ask the questions? I don't know if you can see them. I'm
facilitating that now. One of the questions was, what are some of the technologies they're using for remote hearings for the courts?
So we're using, in California, we're using two. We use both Cisco products, which are highly secure and locked down, and we use that specifically when our vendors are really in the room with the equipment by themselves. If there's any sort of confidentiality or something where they would have a conversation with their legal staff, for example, where we have to leave them alone. We use Cisco equipment that is highly managed, so it only goes point to point. We know the points, we know the configuration. When it's a more open session, we're actually using Skype for Business, and it is working out fairly well for us. As it relates to courts, in California, we have 58 different courts that we work with, and each of them seems to be set up a little differently. They have different technical capabilities, and that's one of the reasons we went to the Skype for business type of, seems to be fairly flexible. We are right now actually getting some requests to use Zoom and a couple of other technologies, and frankly, we're just being very, very flexible in that right now.
Russ, one of the other questions is, how do you handle transcripts that may be required?
Great question, and actually I don't know that off the top of my head. Jan, if you, I know you're on the line, would you keep track of questions that come up and we don't have an answer to, and we will go research that, and I'll publish some information on what we're doing. Let me pause and see if other folks are doing something similar, and maybe somebody from a different jurisdiction has an answer to that. So what are other folks doing as it relates to transcripts for video arraignments or video used in maybe non-traditional means for court appearances or full hearings? Zach, do you see anybody popping up with a response?
Not at this time.
All right, so we'll capture that. I know that we're doing it. I don't know off the top of my head how. So rather than give you that answer, let me research that and find out. All right, you have another question we can hit there, Zach?
How are you connecting inmates?
How are we connecting inmates?
Mm-hmm.
So at this point, we are still taking the inmate down to a room that's set up for this process. So we're not doing it at self-front or in the day rooms or the general areas in the housing units. We actually take them to a facility inside the prison, and we are abiding by the social distancing rules the best of our ability. In some escort conditions, that obviously becomes difficult, but we are using a standard, we call it a hearing room, or I just lost the terminology, essentially the same room that we use for normal hearings. The equipment is set up and configured in one location.
Please mute your lines.
All right. Zach, is there another question on this one?
We can move on.
Okay. All right. So one of the other aspects that I suspect we're all dealing with is a mobile workforce. We're having a lot of folks that are requesting access from home or from a different work site. In California, even though we have essentially a lockdown order, to work from home, for us, corrections is defined as an essential function. So we still do have some people on site. For the folks we do have on site, we're conducting business within the social distancing guidelines, so 6 feet apart, no more than 10 people together at one time. But we are strongly recommending to all of our managers and supervisors that we allow people to work from home. For us, that is very different than anything we've ever done. Most corrections organizations, I venture to guess, are hyper-conservative. I know that we are. So while we had a number of folks that had laptops, we really didn't have a huge capability for functional work at home. People have access to, in our case, Outlook Web Access or Office 365 for email. But beyond that, we didn't have a lot of access. So all of a sudden, we have a dramatic increase in the number of devices that are requested, whether that's laptops or in some cases tablets, lots of telephones or cell phones that are being accessed. So in our instance, we've worked with a number of our vendors to significantly increase licensing capacity. For us, we've been reaching out to our vendors, and a number of them have granted us immediate license increases, and frankly, we'll do a true up after the fact. So for our VPN, VDI products, both of our vendors were very willing to work with us and almost immediately we increased our capacity at the licensing level by about sixfold. Obviously, it's a little more hard if that requires installation of new equipment, and we are having that type of an issue as well as increasing bandwidth. The local telco providers have to work with us to do that as well. So the other thing that we're looking at, rather than having to buy a bunch of laptops, in our jurisdiction, we happen, just on our yearly refresh cycle, we happen to be receiving large quantities of laptops over the next 2 weeks, which will help us, but then we have a huge staff impact to configure and get those distributed. So we're really working with a BYOD type of policy. What can we do to enable staff to use their personal computers that they have at home through some sort of a remote desktop type of application, a VDI application. Obviously, some security bandwidth concerns in there as well. Lots of legal concerns. So if people are doing that, what do we do around e-discovery? Or frankly, do their personal machines become discoverable through a PRA or other sort of legal action or request for information? Is a concern. In our VDI product, we lock it down so you, for example, can't save things out of the VDI client onto your local PC. We have also, at this point, not allowed printing, so they cannot actually print documents. We are having some requests for that, but have not honored those requests at this time because of information security. In many cases, when we're using the remote desktop type of application or desktop as a service, what we're really allowing them to do is RDP and run applications from their networked PC that's at the office. The client itself in the VDI client is generally not configured with a whole bunch of applications, though we are considering that. Right now, we're really pointing them back to their desktops with the assumption that they potentially have work products on their desktops that they need access to. So I'll pause there. Zach, questions on that topic coming in?
Ross, one question that came in is, are jurisdictions finding a need to override standard ISO protocols for authentication to become operational, i.e. suspend need for two-factor authentication?
So that's a great question. We are trying at this point to not suspend any of our ISO rules. We are, though, trying to quickly adapt to being able to do those same assessments and implementations faster. So, for example, we have a telework agreement that an employee and a supervisor have to sign normally. If in our case, we got the order from the governor after hours, people had already left the office and frankly are not coming back. So we've got to find a way to do that. So we're using electronic signatures on those documents and having them submitted that way. Multi-factor authentication, we were actually in the middle of pushing out MFA through just the Office 365 product. We suspended that for a few days. So in essence, the answer is yes. We have limited our use of MFA for access specifically at the Office 365 level, just to not introduce complexity in the middle of our emergency operations center and spinning things up. We will be resuming that next week. And anybody that's going to come in via VDI or VPN type of connections, we are enforcing multi-factor authentication there, so we are not suspending it. Primarily because the risk right now there are so many phishing attacks and ISO type of threats that are frankly ramping up and taking advantage of this health crisis that we do not want to lower our security profile at all to the extent possible. Zach, anything else?
One of the other questions that came in was local IT providers do not support personal devices, so they will not provide VPN on them. Any ideas on getting people access that do not have facility-supported PCs?
So that is exactly that second bullet, that employee BYOD. bring your own device. We have historically had a policy of absolutely not, for all of the same reasons that I think are probably going through everybody's heads at this point. As we stand that up, we are providing the client for folks to run and the software constraints. So for example, right now we're saying in order to run that remote desktop client, it is configured only for Windows 10. We're not supporting any of the retired Windows operating systems. We're not supporting Apple. We're not supporting other tablets. We are experimenting. We are testing with Chromebooks to see if we can support it that way. We think we can get there. But for the time being, we are essentially sticking to the platforms we know. So if an employee has a Windows 10 laptop, that is our standard laptop. We've got the client already configured for it. We're also getting the admonition that we do not have the capacity to support their devices remotely. So if they don't have, if they're struggling with their device, if they have a desktop issue, we don't become the help desk other than trying to help them configure that remote access client. And that's it from our perspective. We realize that that's going to leave some people without the ability to connect, but it's kind of the 80-20 rule. We're trying to get as many people in as we can using processes that we know. We don't want to end up sinking 80% of our resources into supporting 20% of our staff and using non-standard products.
That's some nice background music there. Russ, the last question, I think we should move on at that point since we only have about 35 minutes left in the call. The last question I've got for you is, did you have an increase in demand for VPN? If so, how did California handle the expanded demand?
So let me just give you some statistics. California, we have about 60,000 employees in the system in total. Prior to this event, we had licensed VPN specifically at 500. And on a typical day, by the way, that's 500 concurrent users. On a typical day, we were running with 300 concurrent VPN users. And that includes our parole agents that are doing community-based supervision. We're using a mobile device to connect. And we were not having bottlenecks with throughput. As soon as the coronavirus event kicked off, we worked with our vendors and changed it from 500 to 5,000 concurrent user licenses. The devices that we had, the physical infrastructure is capable of supporting at that level, so it was just a licensing increase for us. To go to the next level actually will require another appliance, which is relatively expensive. So at this point, we're hoping on our VPN side that 5,000 will cover it for California. Today, we are up to roughly 2,000 concurrent connections, and I expect that to grow over the next few days. But we're also spinning up the VDI side or the remote desktop side as well at the same time. So I'm still hoping those 5,000 licensed users, concurrent users, will be enough. But we did take it up effectively tenfold in our ability to support this.
Russ, that's the end of the questions. I think we can move on.
All right, thank you. So I think I mentioned a number of these things. Employees without state-issued equipment. While we do have equipment coming in, we are trying to support people working from their devices. So using that virtual desktop type of system. We are providing them, I mentioned the system requirements, Windows 10. It actually, technology-wise, doesn't take a real robust machine, but it does take a configuration, so we're putting that out. These last two bullets are maybe the most important. This was different. I realize this will be different in different jurisdictions. We have a unionized workforce here, but the written telework agreements, so as we are sending people to work off-site, we actually have a written agreement that says while you're working off-site, your work hours are still expected to be 8 to 5, whatever it is. We're actually working some split shifts to try to reduce load on the network. So we'll have people working from 6 in the morning to 2 in the afternoon, and another group from noon until 8 or something along those lines, which will reduce the demand on the network itself. It also allows broader coverage in a number of areas because we've changed programs within the prisons. The employee management concerns, this for us is a real struggle. We've never done a very good job of training our managers and supervisors throughout our Department of Corrections to manage a remote workforce. By and large, we have been a very much, backside in the seat where I can see you. We manage workload accordingly. All of a sudden to have our entire accounting staff or our HR staff or our financial staff working remotely is a significant challenge. And training our managers and supervisors very quickly to be able to manage that is difficult. I'll give you one example. We use Skype, and we have in the past had a number of our supervisors try to use Skype to enforce, essentially track people to see if they are working. Did they come online when they were supposed to at 9 o'clock? Did they go offline when they were supposed to at lunchtime or at the end of the day? And we have had significant labor issues with that. And the bottom line is we cannot use and will not use Skype or any sort of electronic monitoring to see if people are actually working. Managers and supervisors really need to manage the work and set the expectations. And it is a significant training and mind shift change that has to take place between working on site and working in a home office or working off site remotely away from the supervisor to ensure that the job is getting done at the right level of quality at the right time, that employees are available when they need to be, that there's a method of contact that's established. And a lot of people don't think about those things until after the employee is off site and you cannot get in contact with them. The other thing that we have to worry about a lot, I'm sure you will as well, home office readiness. While we call them laptops, and a lot of people like me will sit on a couch and use the laptop, really we have very strict labor laws. If you are a remote worker and that is now your off-site office, all of the workplace safety requirements are still in effect. We're responsible for the employee and their readiness. So in that telework agreement that they sign, they actually have to assert that their office has the appropriate fire alarms, fire detectors, or smoke detectors, that they are sitting in an ergonomic manner so that they don't have back problems, neck problems, things along those lines. Again, a lot of times when we spin that up as a casual user of telework, we don't worry about that, but if it is your normal workplace, that becomes a requirement that we have to fulfill. All right, Zach, anything on that topic?
I think we can move on at this point.
Thank you. One of the other things that we were already using that we are drastically increasing the capacity on is video conferencing for the use of telemedicine. So telemedicine, telepsych, we don't do teledental yet. Kind of hard to do that or tell people they need to brush their teeth. But there might be some instances where that becomes available. We use it a lot with telemedicine, especially since our prisons are spread out. It's hard to get medical practitioners to work in some of the locations where we have prisons because they're in the middle of the desert. And what we found is that having them work centrally and be able to interact with patients over a video conference works very well. We have not had the same success with mental health. We've been very challenged with that. Our mental health clinicians, frankly, don't like using the technology. Part of their assessment of a patient is being able to sit, interact, and really see the whole body, the interactions, how the patient is presenting themselves. So we do use video conferencing in our mental health areas, but not nearly to the extent that we use it for normal standard health care. We are spinning that up a little bit, though, more than we were using it. One area where we are spinning it up is as we do evaluations before a parole or before a release. We have mental health staff that process, and we are, rather than sending mental health practitioners to the institutions to do those evaluations, for that type of evaluation, we are trying to spin up video conferencing and use it for mental health. And we are literally in the process of doing that now. So I cannot tell you how successful that's been to date. Zach, I saw a couple of questions pop up in there.
I'm getting to it right now. This is really our board members responding with information on their own.
I just saw one pop up that said they'd like to see our telework agreement. I'd be happy to share that. So Jan, if you'll make a note, I will put a copy out on the CTA website that people could pull down and use as a reference. I didn't see a couple of the other comments. Zach, were there? They pop up on my screen, go away very quickly.
Okay, I'm taking a look here. No other questions, just our board members responding.
Okay. Responding with same type of topic?
Just more information around teleworking.
Okay. If there's things in those comments that you want to read, I'm comfortable with that as well.
Okay.
All right. Moving on to that next slide, and I realize we're kind of plowing through this fairly quickly, but I am trying to watch the time a little bit as well. So teleconferencing. We are, one of the things we've done in California, and I know a number of jurisdictions, we have shut off all visiting and family visiting. And obviously that's not a popular topic. So one of the things that we've done, and it's actually on a subsequent slide, is we are trying to figure out how to use video conferencing to connect family members with the offenders that are in our prison system. We have done that with our juvenile system a number of times. By the way, in California, juvenile justice right now is part of the overall Department of Corrections. And so for the last couple of years at Christmas time, for example, we have allowed video calls from the institutions out to family members. Very, very well received. We have not done that in our adult prisons to date, but we are exploring that. We only have a few of our prisons that actually have that capability using a tablet or kiosk device, but we have not taken that step yet. We are exploring it though. Attorney-client, we're using very much the same setup that I mentioned for the hearings. We do have a dedicated room where the offender can interact with a confidential device without our staff in the room back to the attorney. But we are also still allowing attorneys on site for those face-to-face visits if it's essential. The general rule we have right now is anything that's a non-essential function, we're not allowing those people to come through the gate. So we still allow our staff members, service folks that have to come in to support refrigerators or HVAC units, but we have cut off all volunteers. We're really trying to limit the number of people that are going in and out of the prisons itself. And volunteer support, from the time we started this slide deck to now, we have actually closed the gates to all volunteers. So all of our volunteer programs have been shut down, and we are not right now using teleconference for any volunteer-run programs. However, it's something we're talking about. Can we run via a WebEx or a Skype type session, Zoom? Can we run some of those volunteer-led programs and get those back underway? We in California have not taken that step yet, but we are evaluating it. All right, Zach, any questions?
Well, let me just add a few things, Russ, that Virginia has been working with some of our partners, and we're now providing our offenders 2 additional free phone calls per month, just for the fact that we have suspended visitation.
Okay. All right.
Let me read a few things here. Douglas County Department of Corrections, Omaha. We have video visitation. We do not have face-to-face personal visits, but shut off site visits as of Monday. and family members switch to internet visits only. Any jurisdiction suspended or cut rates for family video visitation. And I just noted that we have increased working with our provider, free teleconferences with family members for our offenders. New Mexico has offered extra call times each week and free 2-minute phone calls for each inmate each week. 20-minute calls. All right, Russ, go ahead, take it away.
All right. So a couple of topics just to bounce around on other things that we're considering and might plant a seat for somebody else. Excuse me. So for all the folks that have been sent home, don't have a state laptop, but do have a desktop at work, we're considering the possibility, given that this is an emergency situation, to allow them to take equipment home. So a desktop, typically our desktops on site are not wireless enabled. They are all just hardwired. But we are considering the possibility of rather than waiting on laptops, to go ahead and allow a person to take a desktop home. Let me backfill a little bit of this on the policy and part of what we're doing in California. Effectively, what we've said is if you cannot do your job and you have to stay home, but we do not have the ability to support you with telework, we will give you what's called administrative time off. In other words, we pay our employees to sit at home on the couch. That is a last option, so we are trying to find every mechanism we can to have people gainfully employed when they're at home. We have the option to redirect folks, so if the job that they normally do is not appropriate to do at home because they handle confidential personnel information or whatever it might be, we can redirect them to do something else. And in our organization, we've identified what are the essential functions, and while it may be obvious, we talk about housing inmates, feeding inmates, healthcare, things along those lines. We could redirect, for example, IT staff. If I could not support them doing their jobs at home, I could redirect them to another position in the department to work in the food service inside the institution. We have not taken that step at this point out of my IT organization, but within the institutions, I know that we have redirected folks from their normal jobs into other things that are in those essential functions that allow them to be gainfully employed. I mentioned the working alternative shifts earlier today. To enforce social distancing within the institutions, we are taking things that would be normal programs and splitting them in half. So rather than having 20 people in a room, we might have 10 people in a room, which means we do it twice. So now we're doing it across 2 shifts instead of just one, as an example. The trickle-down effect on that is for an IT organization, we're also splitting our shifts. So we take half of our help desk staff that work earlier in the day and another half later, so we have coverage when those extended activities are happening within the institutions. And I did mention that transfer to other positions already. We are also looking potentially at rotations and equipment drop-off, check-in, check-out to support those. It's something we're exploring. We have not done it yet, but assuming that equipment will be one of our bottlenecks or constraints, how can we make a piece of equipment available potentially to more than one staff member on a rotational basis? So on our telework, it does not have to be you're all telework or all not. We have some folks that we're setting up to work maybe 3 days off-site, 2 days on-site. And that's an instance where that equipment check-in, check-out might work as well. They could hand off a laptop, for example, to a person then that is going off-site. So, Zach, I saw a couple of bubbles pop up there, but I couldn't read them fast enough.
Yeah, so one from Tom Welch is another alternative to issuing laptops to taking wire computers home would be to utilize USB Wi-Fi adapters. That would cut down on demand costs for laptops and tablets. And then there's some. Go ahead, Russ. Sorry. I
was just connecting the dots. USB Wi-Fi adapters. Yes, if we end up sending full desktops home, yeah, absolutely, that would be a way to do it. Or potentially to allow folks to connect just trying to connect the dots. I think that would be the normal instance for us, is if we sent a machine home that did not have a Wi-Fi adapter, that's exactly what we looked at. And Zach, I don't know on the recording, will the comments be available in the recording as well?
That is something I'm not aware of yet, Russ. I will have to pursue that option once we're done with the call.
Again, bear with us on the meeting hygiene. This is set up very quickly, so we're trying to get as much information out as possible.
And I'm logging all questions in chat just in case it doesn't appear on the recording. We're good.
Thank you, Jen. All right. So inmate communications. This actually came up a little bit in some of the other comments. So for us, because we've ceased all visitation, one of the things we're trying to do is get back to some sense of normalcy and connect offenders to their friends and family that are on the outside. So I think a lot of jurisdictions are doing this in different manners. I know we have a couple of the communication vendors that are on the line that might be able to speak to this even in more broad terms than I can. In our jurisdiction, for example, we are allowing a full day of free phone calls for our adult institutions, one day this week, one day next week. When we instituted that program, we didn't know how long the situation was going to last, so obviously we're going to need to explore into the future how we're going to continue to do that. The reason we decided to do that rather than reduced phone rates or a specific number of calls per inmate is in California, we've not yet implemented PIN numbers for offenders. We manage access to the phones through staff, but have not yet implemented PIN. That was actually something that was in flight, but we've kind of ceased operation on that implementation for the time being. Again, just as we deal with the startup of this emergency, we do anticipate implementing PINs here soon, and they change the practice. But for us, what worked best was a full day of free phone calls. The first one happened to be yesterday, and we ran 1.3. Before I give you the number, let me just pull it up. I have it right here. Yes. I wanted to make sure I didn't misstate this. We ran 1.3 million minutes of calling yesterday, of free calling, through our phone vendor at our adult prisons, which is unusually high. Christmas Day last year, we were just under 1 million, so we were 25% over that or a little more. So vastly increased that. We had a lot of very positive public comment that came back to the organization doing that. Obviously, it doesn't completely fulfill the need or the access that was eliminated through turning off visitation, but it is a definite step that helped. I mentioned on our juvenile side, we are spinning up the video conferencing and video calling. We're not doing that on the adult side. The other thing that we've done in conjunction with that free day of calls is we're looking at increasing the standard time for a phone call on other days and making the phones available to inmates more often. So rather than just prescribed times during the day, they would actually have more access to the phones themselves. So again, trying to increase the availability of calling for the inmates themselves. So Zach, anything coming up on comments on that?
Well, let me just say one thing. Greg Levine, do you want to add any additional things from your organization in regards to this?
While Greg is maybe trying, I just saw something pop up from that same company, but it went away before I could read it. We are using a tablet vendor. So in California, we're using a tablet vendor. We've got a pilot implementation at several of our institutions. On the email that's provided or the messaging that's provided from offenders to families, we've also reduced those rates slightly. Not on a daily basis, but actually for the duration of the incident. We reduced the cost of a stamp by 25%. So that is also in flight. I do not have a statistic in front of me, though, on the impact on volume of that reduction. All right, Zach, did we get
some of our vendors are responding. Securus is responding by saying they're working with or open to supporting all the agency partners regarding phone calls, emails, video visitations, video games, etc. Just contact your account manager.
One of the cautions that I would give folks is you'll hear, for example, you heard me say we did 3 calls per day. Other jurisdictions, there are specific reduction in rates. I know in speaking with my secretary, my department secretary, the ASCA organization is conducting calls and they're sharing information. The potential downside or gotcha in there is our phone and communication contracts are not all the same. We've embedded different services across different jurisdictions, but the secretaries may not know the ins and outs of those contracts. So I suspect that your administration folks will be contacting you with an expectation, and based on your contract, it may not work exactly the same. So for example, the original ask to me was different than what we implemented because of the contract we had in place, and frankly, we didn't have pins to be able to do it the way they had originally envisioned. So we met the need, but that is likely a conversation you will have to have with your administrator to talk about what's possible in your contract. And again, as much as we can share information, the vendors that we use have been very amenable and very willing to work with us on those things. But it's not always, one size fits all or one answer is going to work in every jurisdiction. All right, Zach, anything else on that topic?
Just one last thing. GTL has also responded with the same thing. They're working with their agencies as well. Contact your account manager.
Yeah, if you haven't, that's absolutely one of the things I would recommend is contact your account managers on these big services, whether it's special packages, canteen, communications. Work with those vendors. A lot of them have conversations or thought processes going on inside their companies on services they can offer to help minimize the impact of this. We're trying to make operation inside the prison as normal as possible. We know that we've already had a huge impact, and any change in the prison environment escalates tension. You're kind of poking the bear. So we're trying to not suffer any significant incidents because people are on lockdown or people aren't getting their visitation. So we still operate canteen, for example. We operate yard. We're just enforcing the social distancing and separation. And so we let fewer inmates on the yard at a time. Again, over more period of time, that's where the extra shift work comes in. So with that, that's kind of all the topics that we had put out on that original slide. If anybody has any specific topics that we didn't cover, if you want to pound those in on the WebEx client, we can field some of those questions or specifically let you address them. If you have other thoughts or experience on some things that might be good for this group. Okay, so the first time I'm not seeing thought bubbles pop up quickly. There.
So do agency HR training systems provide information about agency staff that may also be members of the National Guard? Could be useful if deployments or workforce planning are made in respective states.
To my knowledge, ours does not. I don't know if anybody else does.
Virginia has not either.
That key to thought for me, which is a completely different topic, but as we have employees at home, if they're not able to perform their normal jobs, one of the things we are asking them to do is complete training. So we have our annual training, everything from defensive driving, information security, Whatever those things are that we might normally take a day in the institutions or in our headquarters office to do the administrative type training, we're trying to use our learning management system and online training to conduct, again, keep people gainfully employed when they're not here. So there are options there. One of the things that we struggled with when we started that is that the way we have our LMS set up, you have to be on a domain registered computer. In other words, you couldn't do it from home unless you had a VPN connection. So we are trying to figure out how to put that in a DMZ right now to make that available for folks from a personal computer not connected to us. Also potentially reduce some of the bandwidth of our private network.
Yeah, Russ, North Dakota State Penitentiary has worked with their plant services staff to change their air intake to increase fresh air being brought into the housing units. And so they're working on their air handlers to exhaust 100% of the air in the unit we designated for quarantine. And I will tell you that Virginia, we were going to open up one of our prisons for women in Culpeper, and that got sidelined a number of years ago. But we have now gone back into that facility and to ensure that it is up and ready in case we have to have quarantine, in case we have a quarantine situation.
I've seen reports on the news, and I know we are talking about it in California and how to make bed space available to be able to move folks around in the event that we have to do quarantine and separation inside the prisons. Obviously, it's very difficult, especially if you have prisons in a dorm type setting. But I know some jurisdictions are looking at lower level offenders that could be coming up on release dates. They could potentially be released early. The other thing that I'll throw out that might be for interesting consideration for folks, in our programs, and a lot of our rehabilitative programs and our self-help programs, we actually provide inmates credit via those programs. In other words, they can shorten their duration, accelerate their release date. Because we've canceled a number of those programs, we've made a policy call that those offenders will continue to accrue that credit just like they were sitting in the program, because the program was canceled by no fault of their own. And so in our offender management system, in our sentence calculation area, we are having to figure out how to actually implement that through a process that still grants those same scheduled inmates the credit that they would have earned, so they're not being penalized for something that's outside of their control.
Hey, Russ, I have a question for you. It may be an interest to the 111 people that we've got on the call right now, since they're all CTA members. Any kind of status on the CTA summit coming up?
Fair question. So at this point, because we don't know the duration of this, and this is still changing on a daily basis, we have not canceled the summit. I will tell you that we're looking at alternative dates with the potential of being able to reschedule it. In a board call just this week, we have set our April 2nd board meeting as the date where we plan to decide what to do. At that point, would we continue, would we cancel, or would we reschedule? Things are developing so quickly that, frankly, until now, we were hoping that we'd be able to continue with the meeting as scheduled in St. Louis, starting on May 31st through June 3rd. As this develops, that's looking more and more unlikely, but again, I just don't know enough sitting here today to know for sure. The plan right now is that our April 2nd meeting, as I mentioned, we will make a call and start to publish that. And in between, we're trying to work with St. Louis and figure out what their plan is and what availability the conference site would be, and what other alternatives are there. We do know that a lot of people are getting executive orders within their jurisdictions indicating they should cancel all non-essential trips. I have that same order in California. What I would encourage people to do right now is if you must cancel, we understand that, but go ahead and continue your registration And if we have to refund, CTA will refund, the hotel will refund. We've already confirmed that. But in the event that we reschedule, we would just ship the dates and handle it there. So more information will be coming out the first week of April is the short answer to that.
Okay, Russ, we've got 1 minute left in the call.
All right. With that, any last questions that we can address? And Zach, anything popping up on the chat there?
Lori Mercer just said some agencies are using or are looking at app-based mobile compliance and reporting technology. This would enable probation and parole officers to conduct virtual meetings, check-ins, and rehabilitative support services.
In California in particular, we've been using that technology for our parolees to an extent. We are amping that up to again, minimize the risk of transmission. But whether it's an OMS vendor or new providers, absolutely that capability exists. And I think there are a number of members that can provide information on that via the listserv if people post questions there.
All right, and the remaining ones are giving you kudos for putting this on, Russ.
All right. So for anybody that's still out there, let me ask one question of you. Last question. Would it be worthwhile to do this on maybe every other week basis as new things develop? I'm not necessarily looking for a bunch of responses here, but if you could provide us feedback on the listserv or even a direct email to me at the email you see on the screen, president@correctionstech.org, we would be happy to see how we can add service to the industry. And with that,
you've had 7 people already reply yes.
All right. Thank you, Zach. With that, Zach, thank you for helping get this set up in such short order. Thank you, everybody, for jumping on the phone. I hope this was useful and provided some information. And we look forward to talking to you again. And again, use the listserv to ask questions between now and any next session.
Thank you, Russ. Thank you, everyone.
Thanks, everybody.